Slim Chickens is the proud kitchen sponsor for New Mexico Living.
Being in tune with your body, that's what we are diving into today with Dr. Stevie DeJuan Springer.
Yeah, that's right. We're joined by Dr. Stevie DeJuan Springer along with a cancer survivor, Roseanne Vona-Page, talking about what cancer symptoms look like, as well as highlighting nutrition and the role it plays in our overall health. Guys, welcome. Thank you so much for joining us today.
Thanks for being here.
Stevie, maybe a question that we all is kind of, I don't know, we all know the answer to, or maybe it's a common question, I don't know. Why is it important to know just about our overall health and be in tune with our bodies?
Sure. Well, first of all, thank you for having us on. It's always a pleasure to come on and address questions from the community. But you know, I think one of the biggest things that we must become aware of is when we are in tune with our bodies and understanding the overall perspective of health, it is actually understand what your body needs. And the more in tune that we are within our bodies, we can understand how we need to go out and be vigilant with the things that we're doing, the foods that we're eating, the activities that we're a part of. When you break down how your body ingests things, then you're able to really understand the productivity that you're able to do when you're out in the community, when you're at work. And so I produced a book called Health Matters. And so in that book, I talk about adolescents, I talk about teens, I talk about elderly adults, and how we need to actually be really, really particular about the things that we eat, about how we treat our bodies. And so health needs to matter, and it needs to matter beyond the perspective of what we need to do that day just to get to work, what we need to do that day just to get to an activity, or what we need to do just to get through the day and have sleep. We really need to be mindful of the things that we're doing throughout the day.
You know, and I think people can look at our health as this big complex thing. It doesn't necessarily always have to be, but one thing that is complex that we're going to address today is cancer specifically, and just kind of how cancer symptoms present themselves. Can we talk about that?
Sure. So some of the signs that you always want to be aware of course, is chronic fatigue, persistent pain, unusual bleeding or skin lump changes may indicate early cancer. And so when you are recognizing some of these areas of concern, then you want to make sure that you have routine screenings like mammograms, colonoscopies, a PSA tests, and blood work detects cancer early. There's some things that we look within panels that allows us to know whether or not we have tumors that are building up. And so when you have these type of maybe family history of cancer in some areas will also allow us to know if we need to have screenings. But we need to always be aware of some of these signs and symptoms. And a lot of the signs and symptoms bleed into other areas that you may be having, if it's hypertension, if it's diabetes, if it's you know, any other area that dealing with high blood pressure. And so any of these concerns, you need to get in and receive screenings.
Absolutely. Roseanne, I want to talk to you. You're a two-time cancer survivor. Oh my gosh, that's...
Congratulations.
Yeah. Can you just talk to us about your journey and what you went through with these cancer diagnoses?
So I was diagnosed initially in 2016, and I didn't really have any symptoms.
Wow.
That's the scary thing.
Really?
And I remember I was going to lunch with my husband, Paul, and I took a shower. I said, can I take a shower? Because I was at an event in the beginning of the day. And I just happened to feel something that wasn't right. And so I said to him, this really doesn't feel right. And he said, get a mammogram. Because I had missed my mammogram because of work, because I was so busy with what I was doing that I just neglected to have it done.
Sure.
And it was so important because there it was.
Wow.
Yeah.
So talk to me about that initial diagnosis and kind of how you were proactive in making sure that you were going to beat this cancer.
Well, I started treatment right away as soon as I had my mammogram, and I let them know that I thought that I may have something going on. And so they took me in right away. They were very good. And it's kind of a process, and it can be a little bit disconcerting, but with me, it was like I trusted my doctors and the people who surrounded me, and so I felt like I was getting good care, and that's important.
It is important, absolutely.
What was the journey like once you got the cancer to beating it? What was the journey like in between?
So I had radiation, and I had the tumor removed. I had surgery the first time, not the second time, but I didn't have chemo, which my dear sweet cousin Elaine had chemo and she lost her hair and everything. And I was so concerned about losing my hair, but I didn't have the BRCA, the BRCA gene. She had it because it was on her mother's side, and I'm on her father's side. But they do all that testing for you. You don't really have to think about it. And so I got that treatment, and after that treatment was done, they didn't see any more issue. But I did have an MRI, and the MRI found a tumor under my left side, because the tumor on my right side was visible. But the one on my left side was tucked under the muscle, and it wasn't visible on the ultrasounds and all that other stuff that they do.
Well, you're here today, a 2-time cancer survivor, which is absolutely beautiful. And I just have to ask anyone out there that's watching this interview that is going through their own cancer battle or knows somebody that is, what advice would you give to them to just stay strong during the process?
I would say make sure that you exercise and eat well. And just take care of yourself because you're going to make it. We have lots of treatments now, like mine, which is targeted therapy. It's not the kind of chemo that will kill all the cells. It only goes to the cells that are cancer cells, and it dissolves the protein so that the cancer cell can't live. It's amazing. I don't know how they discovered it.
We love the modern medicine.
Absolutely. You said eat well really quickly. Got about 30 seconds here. Can you talk to us about the food you got right here?
Absolutely. So then I have some, a list of things there that you can definitely be a part of, partake in. These are some wonderful treats. We have a dipped dark chocolate bananas, which is a really good treat for cancer patients if you're in treatment or even remission. And then Miss Roseanne cooked some wonderful blueberry pancakes. Miss Roseanne, what do you have here on the...
I have pancakes with blueberries, and berries are really important to cancer patients because they have antioxidants and they really help to keep your cells healthy, and that's what we want to do.
Absolutely.
Great. And they're also made with what kind of flour?
Cake flour.
Yeah, they look delicious. They look super fluffy. I just kind of want to like touch one.
Guys, thank you so much for coming in today. Stevie, a lot of really important information. Roseanne, thank you so much for telling us your story. Congratulations. You're a true warrior. It was great having you on the show today.
Thank you so much.
Yes, guys, it was great having you here today. All right, for more information on this entire interview, guys, head on over to krqe.com. Click on that New Mexico Living tab.
Stay with us. There is more New Mexico Living when we return after the short break.